The second presentation of the child with disorders will be on attention deficit hyperactivity disorder. The main features of the ADHD or the attention hyperactivity disorder include excessively hyperactive behavior or excessively inattentive or impulsive behavior. The prevalence of ADHD, it is very common, constituting about 5 to 8% of the school-age children. 60% of those having ADHD continue to experience the symptoms as adults. However, they are predominantly inattentive rather than hyperactive ones. Children with ADHD are more likely to have problems at school when they are graduated from the high school and maintaining a job. Some of the other persons might be abusing drugs or having difficulty to have healthy relationships. Diagnosis of ADHD requires very specific prerequisites. Number one, it has to be appeared by the middle childhood. The symptoms continue for 6 months or more, and these symptoms are significantly impairing the normal functions for children at school, at home, among friends, and for adults at work and at home. To diagnose ADHD, there are no objective diagnostic tests, only comprehensive evaluation, including clinical interview, parent-teacher ratings for children, self-rating, and other ratings for adults. This should be coupled with learning and psychological testing to detect the associated learning and psychiatric problems. The etiology and the pathogenesis. ADHD has got a strong genetic influence, and this based on the twin and family studies. The genes which are involved are the genes encoding for dopamine and norepinephrine neurotransmitters. The altered activity in the circuits connecting the cortex, the striatum, and the cerebellum, especially the right hemisphere, are usually involved. Brain imaging studies show reduced catecholamine transmission, especially the prefrontal cortex, whose circuits require an optimal level of catecholamine stimulation. Reduced catecholamine stimulation will lead to weakened prefrontal cortical regulation of attention and behavior, and all the full-blown picture of the ADHD. And this graph shows one of the imaging modalities of the brain. It's called PET scan, and here we can see the lower level of dopamine transporters in the nucleus accumbens, and it is part of the brain reward center. This is highly pathognomonic for ADHD. Treatment of ADHD includes parents' education coupled with school-based interventions, and some medications might be used, like the stimulant drugs, for example methylphenidate, and the newer non-stimulant drugs like the atomoxetine, and these drugs enhance catecholamine transmission. There is no cure for ADHD at this time. The treatment effectiveness should be re-evaluated in each person on a regular basis to determine if the current treatment continues to be optimal. This finishes our presentation.